My name is Sanjay Gupta. I'm a cardiologist in York. Today's video is likely to show you the view, which is just astonishing. It's a glorious day today, and it's about 6:30, 7 o'clock in the morning. So the birds are singing, and it is just beautiful. This is a golf course that belongs to a castle near our house, and we're very lucky to get a good view of this every morning. So today's video is when to start and when to stop, a personal reflection on medications and time. So there's a story I've carried with me for years. I've shared this with you. It is the story of my father. As you know, I'm an only child. I was very attached to my father, and I was and am heartbroken that he's no longer with us. But when I was young, my father had a heart attack. He was only 39 years old at that time. And for me, as an only child, it was terrifying. Life suddenly became fragile and uncertain. After his heart attack, he was started on a beta blocker, a medicine that slows the heart, reduces stress on it, and lowers the risk of future events. Later, many years later, they discovered that aspirin was helpful as well, so he was started on aspirin. But from that day forward, he never missed a dose. The beta blocker became his lifeline. To him, it wasn't just a tablet. It was hope. It was protection. It was non-negotiable. In fact, I would say for the whole family, me, my mum, it was non-negotiable. We thought this tablet is the reason he is still with us and he cannot stop. But time moves on. As the years passed, he lived a good life. He worked, he loved, he provided. But then slowly age caught up with him. He developed dementia. His cognition declined. Then came issues with digestion, constipation, liver function. And suddenly his list of medications began to grow. Anti-nausea drugs, laxatives, liver medications, supplements. The prescription bag became heavier and heavier. And somewhere in that pile was still his beloved beta blocker. At some point, as a doctor and as a son, I asked myself, why is he still taking a beta blocker? It's been nearly 40 years since his heart attack. And more importantly, is this drug still helping him? Or is it now just habit, inertia, routine, masquerading as necessity? You see, as a son, if I went into medicine, I would have wanted him to continue this for life. It would have been an emotional decision. However, as a doctor, I started questioning. I said, well, everyone is saying you must take it, but what is the evidence? Because this prescription bag is getting bigger and bigger, and we have to start thinking about what medications are unnecessary, because he wouldn't actually have room for breakfast after taking all these tablets. And there were some medications that were obviously helping him, like the medications to help him with his constipation, which was more distressing to him than anything else. So I thought I'd go and look at the evidence. And this is what the evidence said. Beta blockers are a mainstay after a heart attack, especially in the first 1 to 3 years. Multiple studies have shown that they may improve outcome, particularly reduce mortality and another heart attack, particularly in those people who had a weak heart or those who had ongoing angina and arrhythmias. My father had a strong heart, and he did not have any ongoing angina or arrhythmias. So what about for those people who were stable, like my father? And I looked this up, and in 2017, there was a meta-analysis in the Journal of the American College of Cardiology, and it found that in patients with preserved heart function, the mortality benefit of beta blockers wanes significantly after 1 to 3 years. And then in 2022, there was a registry study in the JAMA Network Open, which showed that beyond 1 year after a heart attack, continued beta blocker use in stable patients did not significantly reduce mortality, unless there was ongoing heart failure or arrhythmias. In other words, the evidence fades, but the prescriptions continue. So we have to start understanding the shift in the risk-benefit ratio. In medicine, we are good at starting medications, but we are not always good at asking, when is the benefit no longer greater than the harm? Because as more and more problems emerge as we age, more medications are added, and suddenly the risk is no longer the original disease. The risk is now polypharmacy itself, the drug interactions, the side effects, the confusion, and even falls. And in elderly patients, beta blockers can worsen fatigue, contribute to bradycardia or a slow heart rate, and possibly exacerbate cognitive slowing. So in my father's final years, his greatest risks weren't cardiovascular anymore. They were cognitive, functional, gastrointestinal, emotional. And yet, we were still clinging to something that may have helped once, but now perhaps no longer did. That was a wake-up call. So here's what I'd say to anyone on long-term medications, especially if you've been on them for decades. Ask, why are you taking them? Ask whether they're still helping, and ask whether you'd benefit from a medication review. Because just as important as starting the right medication is knowing when it's time to let go of the ones that no longer serve you. So, I hope you enjoyed this video, but I'm now going to move myself out of this picture just so that you can enjoy the view, you know, something far prettier behind me. All right, well, all the best. Take care.